Hello, hello, hello. I'm Dr. Brandt Gibson, and today we're going to talk to you about Haglund's disease as one of the types of heel spurs that you can actually have. So if you remember, we're talking about the heel spurs to the back of the heel, not the bottom of the heel, because that's a symptom of plantar fasciitis that we've talked about previously. So the back of the heel, you can have the heel spur in the back itself, or you can have an overgrowth of the prominence here on the calcaneus that becomes a Haglund's disease. And the issue with that is you'll get this prominence. It'll start to rub on shoes. It will start to be an issue with walking, and it will start to cause pressure on the Achilles tendon, which can be problematic. And what happens with that is you'll get a prominence. So if you touch the back of your heel, it's a prominence that doesn't sit right straight in the back. It sits on the outside, kind of the outside of the heel, but it can cause pretty significant discomfort, pretty significant pain. And so it is what we call the Haglund's disease. And Haglund's disease is that overgrowth, and it can be pretty painful, pretty problematic, and it is often difficult to treat. So you actually get that pressure there, and the conservative treatments that many individuals will use is they'll do similar to any of the other heel spurs. They'll say, okay, I'm going to use padding, I'm going to limit shoes that put pressure in that area, or I'm going to use a heel lift. And all of these are just to decrease symptoms and decrease the pressure in the area. If it's pretty problematic or pretty sore, you can also use ice and anti-inflammatories like ibuprofen or Aleve or Advil, those kind of things. The point is decreasing the inflammation in that area will help the pain, but the prominence is still there. And so a lot of times you may have to go a little bit further and may have to do surgical correction. So later today, I'm going to actually talk about surgical correction and what you can actually do to treat a Haglund's disease to get you back to normal activities without limitation. And as opposed to most surgical corrections of the heel spurs in this area, this one can actually allow you to recover more quickly and get back to normal more quickly. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 234. And this was supposed to be done yesterday, but I was unable to get it done. So we're doing it this morning, and we will do a second one later on today. Thank you, and have a great rest of your day.